Hi there. I'm Dr. Colinda Linde, clinical psychologist, and I'm also a SADAG board member. And today I'm going to be speaking to you about anxiety, specifically the two most common anxieties, which would be generalized anxiety and panic disorder. So, what causes anxiety? Often we begin with why, and we can think of this as a nature-nurture combination, where around about 1 in 4 have a genetic vulnerability to anxiety. So that means that at some point, this anxiety is going to pop out. And you can think about it as a seed, which is your genetic vulnerability. And then when there are certain conditions, certain rainfall or experiences, then the seed ripens as either a panic attack or panic disorder or generalized anxiety disorder. And when we think about conditions, they can be many things. They can be hormonal, think of puberty, having a baby. It can be something like a life shock, a loss, maybe a divorce, maybe a big change. And then there are also chronic environmental things going on. So if we look at how the world is right now, there's a lot of stress, the cost of living, that sort of thing. And then, unfortunately, very traumatic experiences. If we think there's a war going on, there are a lot of environmental things, climate change, and then psychological trauma. So all of these things are the conditions which then allow the seed to ripen as a disorder, and I'll explain that more as we go. The other thing to remember is that stress can contribute, of course it does, and especially if it's acute, something really extreme, that can often be attached to panic disorder. And in the case of generalized anxiety, it just pushes up the baseline adrenaline. But stress alone is not causal. It's not enough to actually cause something like a panic disorder or a generalized anxiety. So let's talk about the first anxiety disorder I mentioned, generalized anxiety disorder. So this disorder happens in about 3 to 8% of the population. And I did that calculation when we were at 7 point something billion, so it's a little bit more now. But 3% at that time was 240 million. So that means that right now, 240 million people at least are experiencing an episode of generalized anxiety. And you can think about it like this, that it tends to come and go like a wave. So when you're in an episode, you'll have excessive worry about a variety of topics, and that will be for 6 months most days. And it'll be a range of things. It'll be about money, it'll be about your family, it'll be about your health, about the planet, and so on. And the worry is also challenging to control. So it's not normal worry in all of those things I listed. I think we think about those things, yes, and we even worry about them sometimes, but this is excessive and extreme. So that's the marker. Also, it's now going on for 6 months most days. Very difficult to control. And then we have a whole host of physical symptoms. And you can imagine that there would be fatigue, restlessness, aches and pains that come and go. Sleep disturbance, and of course the muscle one, but that's a muscle disturbance that comes and goes. And the key thing is that these symptoms, this collection of the worry and the physical symptoms, cause significant distress and impairment in your functioning, be it socially or be it in terms of work, your occupational functioning. So this is the clinical picture of generalized anxiety. But how does it actually show up? So you can think about it as having two baskets of symptoms. So the first basket is cognitive and the second is physiological. So let's talk about the cognitive symptoms first. So the first one is there's a lot of anticipation. And as I've already mentioned, there's a preoccupation with negative events and then the worry about what if and what's going to happen, and then what's going to happen. So this is also across several domains. It'll jump between all of those things: family, work, finance, the planet, etc. Also, there's a poor tolerance for uncertainty. So if there's any kind of uncertainty and you've got generalized anxiety, you're going to just jump to the worst conclusion. Anything ambiguous, you're going to assume the worst. And then finally, worry, which is repetitive in a vicious cycle. It's chronic and it is definitely excess for the context. So this is the cognitive basket of symptoms. Then we get to the physiological, and I often like to describe this as yellow alert. You're not quite red, panic, and you're certainly not green, relaxed. So there's this yellow alert and a constant bracing, what's going to happen. And because of this, you can see that the hyperarousal leads to a muscle tension, feeling on edge, aches and pains, digestive symptoms. So there's a whole host of physiological symptoms that come and go, and they're there most days. So this is how GAD shows up. Now, what are we going to do about it? So how do we manage it using CBT, which is Cognitive Behavioural Therapy? Also, just to note that CBT has been proven to work better than anything else, any other kind of therapy for all the anxiety disorders as well as depression and a few others. So let's talk a little bit about CBT within these two baskets of symptoms. So the first basket, the cognitive basket, remember there was a lot of worry there. And so what is good to do is to encourage yourself, if it's you or your loved one, to stay in the present. So this is where you have the power, my response right now. And what I often like to say to my clients is, it doesn't matter who dealt you these cards or who is going to deal you these cards in future, whatever or whoever you believe in. And even if you believe in no other being, it's still not you. So rather focus on playing the cards you have in hand right now in the present. So that's the first way of approaching GAD from a CBT perspective. The second part is all about reality testing. So we know with GAD that a small thing which seems to be uncertain, ambiguous, will immediately become worst case. So instead of best case, in between, worst case, the person will always go towards worst case immediately. So for example, you're trying to call a loved one and they're not picking up and they're not answering your messages. And so worst case is they're in deep, deep trouble or they're dead. Or maybe they're having an affair, something extreme. And so we would look at reality testing, as in, do they always answer? And sometimes you'll think, yes, of course they always do. But when you start looking at the facts and the evidence, you'll realize that actually they don't always. And on the occasions when they haven't always answered, how many times has it been because of something serious? And how many times has it been because the phone was on silent, they were distracted, they were in a movie, they were very busy with a piece of work, maybe they were driving somewhere where there was poor reception. So when we start to reality test like that, we can see that actually my all or nothing thinking, assuming the worst, is not necessarily true. And then something else which is quite helpful to do is when people worry a lot, there's sometimes a superstitious feeling that, well, I should just worry in case. And if I worry, it's all going to be okay. And this sort of superstitiousness makes you feel like I should worry, I must worry, because if I don't, something will go wrong. And then the reality test here would be, well, does this work for you? Does it always stop things from going wrong? Does it always prevent any kind of negativity? And of course, the answer would be no, it doesn't. Because sadly, worrying about it feels like you're doing something, but it's actually stopping you from doing something functional, and it doesn't actually get you anywhere or remove the anxiety. We know that it's a vicious cycle that keeps going. So these are just some ideas of what we would do in a CBT context. And then with the physiological, we have many tricks. So we have lots of kinds of progressive muscle relaxation. I can talk you through one right now. Find something you can squeeze. It could be if you have a squeeze ball, or it could be the side of the chair. It could be a scarf if you're wearing one. And this is one that helps very much. So we're going to squeeze and breathe in through the nose, and then slowly release and slowly exhale through the mouth. So breathe in and squeeze, and slowly out. And now when we breathe out, we're going to breathe out over the lower lip. So we're going to go like this. So breathe in and squeeze. And slowly out as you release. And a few of these work incredibly well, just to drop that level of yellow alert. So there are a whole host of those. And then, of course, we know that exercise, 20 to 30 minutes a day, or just a brisk walk, elevating your heart rate, that's incredibly effective in dropping the baseline anxiety. Mindfulness, I'll be doing one of those exercises at the end. And then, as I mentioned, a whole host of CBT techniques, progressive muscle relaxation, tensing your whole body and then suddenly relaxing it. So there are a whole host of those that you can do. And on my self-help website, thoughtsfirst.com, there's a download, which is a free download explaining the cognitive technique. How do you reality test? And of course, on the sadag.org website, there are many, many resources. So let's talk about the other anxiety disorder, which is panic attacks and panic disorder. So round about 5% of the population at least have panic disorder, and panic has no discrimination. It doesn't matter what your socioeconomic status is. It doesn't matter what your age is, your gender, your race, where you live, what you do. Panic is across the board, so anybody can have a panic attack. And you can think about panic as the pot is too hot, and when it boils over, that boiling over is the actual panic attack. So there's a build-up, which could be stress. It could be those environmental factors I mentioned. Maybe you've got generalized anxiety or something like social anxiety, and there's a constant build-up of pressure. Pot is too hot, and one day it boils over, and that's a panic attack. What happens in a panic attack is that you're not aware that your pot is too hot. So out of the blue, you have sudden, unexpected, terrifying physical symptoms, which are rapidly spiraling, becoming more and more extreme. So can you imagine if you were listening to this and suddenly out of nowhere, you started feeling your heart racing rapidly and you felt breathless, you can't get air, and there's a terrible nausea and you're very hot and your thoughts are scattered and foggy. So that's what would happen in a panic attack. There's no warning that you can see anyway. You don't know that you've been building towards the pot boiling over, and you have these terrifying symptoms. And usually there's one dominant symptom. It could be very much the pulmonary, the breathing, feeling I'm choking, can't get air. Other people have more the cardiac symptoms, so the heart's racing, and their chest is very uncomfortable. And others have the tingling and then the numbness going through the body. Some people have the dominant symptom as the digestive symptom, nausea. And for some unfortunate people, there's either vomiting or diarrhea, which is terrible when it happens unexpectedly in public. And for others, the physical symptoms are there, but the dominant symptoms are the cognitive. I'm going crazy, I'm losing control, what if I start screaming, what if I just run out of the room, what if I jump off this building, I'm going crazy, a lot of that cognitive. And all of these are actually happening, but certainly there are symptoms that tend to be a little bit more extreme for everybody. And that will also be important in the treatment. So we'll target the symptoms in the order of severity. Now, after the first panic attack, what happens is that there's a fear cycle with a lot of anticipation. What if that awful thing happens again? And this is where we get the agoraphobia and the avoidance. And I'm going to take you through the CBT model of panic in a moment. So if we have a look at this model, what panic really is, if we look at the DSM, is a catastrophic misinterpretation of physical sensations. So those physical sensations I mentioned to you before, the heart and the breath and the thoughts, all of these things coming out of the blue, it begins here. So you've got these physical sensations, and of course your first response is going to be thinking, this is a threat, this is dangerous, this is very bad. Now when you think threat, you activate the fight or flight response, and you get more physical sensations. Now you're feeling even worse. So you're thinking this is really scary, this is dangerous, and you're in a spiral. And sometimes that can go on for hours until you get to the ER and they knock you out, basically. So this is the first panic attack, the catastrophic misinterpretation of this host of physical sensations. But afterwards, these thoughts start to think about the situation. And this is where the fear of fear happens. So say if you were in a mall and you start thinking, I cannot go into crowds because if I do that again, I'm going to have that terrible panic feeling. And so you start avoiding shopping malls. Maybe you avoid your place of worship. Maybe you don't want to go to movies. So the situation and thinking about the situation feels scary. And what's ironic is that when you're sitting at home safely, but thinking enough about the situation where the panic happened or where it could still happen, that activates fight or flight. Then you get physical symptoms, and now you're getting panic feelings while sitting at home, just thinking about the situation. And this becomes evidence for the brain that this situation is scary and that I should avoid it. And this is what we're talking about with anticipatory anxiety and the avoidance, where you would do anything to not trigger that awful feeling again. Because in your mind, or in your brain anyway, there's a list of situations where this might happen, and you'll do anything to not ever let that happen again. How do we manage panic from a CBT perspective? So the first thing, knowledge is power. So what I've just explained to you will be explained in the first session in great detail, much more detail even. We'll also explain where in the brain, in the primitive brain, the panic is sitting as a conditioned response and exactly what the treatment will entail to decondition that. We'll also look at ways of dropping that baseline, because obviously when you're in this panic, fear of fear cycle, your baseline is very, very high, and it's very easy for you to have another panic attack. And we do that through a few ways. One could be a daily kind of relaxation, like the one I showed you before. It could be mindfulness or meditation. It could be exercise. And this is also where meds will come in. I'll talk more about them later. Once we've done that, we then do a set of exercises called interoceptive deconditioning. So looking back at the model where you saw there was the physical, the thoughts, the situation, this is where we are directly dealing with the physical and the thoughts. So this has now become a conditioned response where your primitive brain is scared of those physical sensations. And so we have a very gentle, structured approach to deconditioning those physical sensations. And once we've done that, we then tackle the situations. And we do a graded exposure. So we have a hierarchy. So say, for example, if it was driving, maybe initially you drive with someone who's reassuring, then you drive with someone who's keeping quiet, then you drive, or somebody drives behind you, and then maybe somebody drives 10 minutes behind you. So we grade it. Maybe initially you have your phone, and then you have your phone off, and then you don't have your phone. So all of these things are unique to the person, and we go very gently up that hierarchy. We don't ever push, and we don't believe in flooding. So it's very gradual. And in the beginning, we would use phobic aids. That would be either myself or I would train somebody to go along with a person, and safety cues like their phone, for example. So these are the steps to using CBT to getting rid of panic. And I also have something on thoughts first. And there are some further videos on the sadag.org homepage. Now, what do you do during a panic attack? So this is if you're with somebody, either on the phone or with them. The first thing to try and remember in your mind is that the feeling is real, but the alarm is false. And if the person is open to this and you're talking to them, you can use this knowledge. For example, you're feeling really scared and you're feeling like you're going to crash the car, because that's usually when people call in, or you're feeling like you're going to die. This is actually a false alarm. And this is especially helpful if you know the person and you've had this conversation. But even if they're calling and you're trying to just help them through the panic attack, sometimes this can be helpful. That you're not saying the feeling's fake, you're not saying snap out of it. You're saying the feeling is real and it's terrible. And at the same time, that alarm is false. And then you can also remind them, or you can remember this, that each panic attack has a 2 to 4 minute life. So that's the spiral I showed you earlier, which was the physical and then the thoughts. That thing releases a spurt of adrenaline, which has a 2 to 4 minute life. So it's not necessarily helpful to do this on the phone to explain all the theory, but because you know it, you can use distraction. So tell me a little bit about yourself. Oh, you're driving on that highway. Okay, so yeah, where have you been and where are you going? And oh, I've just been to visit so and so. Oh, okay, so do you have a big family? And so can you see what I'm doing? I'm using distraction. This is not the place to use mindfulness, please. You do not want them focusing in on those sensations. So this is not a place where we want to be doing that, certainly not. What you could do maybe is grounding, feel the wheel under your hands. Oh, do you have a smooth steering wheel or does it have a pattern on it? And what car is it? And when did you get it? And what color is it? Oh, I like that color too. So a bit of grounding and then the distraction, because you want to try and break that cycle for the 2 to 4 minutes. The next thing to remember is that panic, fight or flight, and survival instinct are one reflex, but with 3 different names. And this can be very helpful for somebody to know. And this is linked to the first one. The feeling is real, but the alarm is false. So your survival instinct has been falsely triggered. And even in a panic attack, this might be quite interesting. And this again functions as a distraction. You can say, I bet you didn't know that panic, fight or flight, and survival instinct are actually 3 names. So it's like one actor playing 3 roles, but they're actually one system. The primitive brain just has the one, survival instinct. And a panic attack is when it's being triggered erroneously. Tell me that wouldn't intrigue you. So that might be something useful to say to somebody. And then the other thing for you is to slow it down. So you keep your voice very even. You don't want to agitate anything. You just keep it even. And even if you forget everything I told you today and you're on the phone with somebody, you're with them and you just remind them, I'm with you. I'll stay on the line with you. We can do this. Let's breathe together. Let's do a nice slow exhale, because all of those are going to drop their baseline, or otherwise distraction. Remember, distraction also, slow it down, keep it very calm, keep it even. Okay, you're almost at the off-ramp. You can do this. How about we do 5 really gentle exhales and you just slow it all down? Or if you're physically with somebody, some people can exercise out the panic, but normally they're very agitated and very scattered, or they're frozen. So just gently moving can also be very helpful. So anxiety and meds. I've mentioned the CBT, and now I'm going to just give a quick overview around the medication side of things. What normally would be looked at would be family history. So obviously, if there's a strong family history, the odds are that the genetics are a little bit stronger. You'd also look at the duration. How long has this been going on? If somebody's had 1 or 2 panic attacks, maybe that doesn't justify going on longer term meds. But if they've had it for several months or several years, and especially if they're going through a very stressful or difficult life transition or something like that, then odds are that they're going to benefit from meds. And of course, the severity. Is the person so impacted that they can't function in their daily life, socially, they can't leave the house, they can't work? Then I'm sure you can see that there would definitely be a reason to be able to drop that baseline with something chemical. And this also makes somebody reachable for therapy, because you can imagine if they're in an acute state, they're not really going to be listening to anything that's being said. So this is where the talk therapy, the relaxation, all of those things, the mindfulness, and the chemical interventions are very useful to do together. And not everybody wants to go on meds. Some people can't because of side effects. So that's where they need to look at alternate things, but they've got to be able to drop that baseline, be it something homeopathic or Ayurvedic or something like that, be it shifting their diet, maybe cutting out stimulant, sugar, and then definitely increasing exercise, making sure they get enough sleep. So the meds really are all to do with the baseline. How do they put a chemical blanket around you and dampen down the feeling, the actual sensation of the anxiety? And when it comes to panic, if it hasn't been going on for that long, then you often don't need meds. But with generalized anxiety, it is chronic, it is pervasive. And if it's been a long time, especially with a long family history, then at least for a period of time, it just gives your brain a break to actually go on something just to dampen down that constant activation. So these are just some factors to keep in mind around the meds. And what most psychiatrists say, so it sticks in my mind, start slow, stay low. So you don't have to be a zombie. In fact, you shouldn't be a zombie. And we'd normally be looking at maybe like an SSRI. If there were going to be any benzodiazepines, they're highly addictive, so that might just be in the first week or so, just to drop that baseline and give the person some relief, and then they'll be phased out. So start slow and stay low. So I did promise you that we would do an anxiety and mindfulness exercise, and this one works for everything. It works for stress, it works for panic, it works for generalized anxiety, and this is probably my favorite, and certainly it's a favorite at the practice. So I'm going to speak you through a quick version of this one. If you're looking at the screen, you can see that there are some clouds and there's a sky. So if you're looking at the clouds, you can see that they're transient, they keep changing. You can also see that at some point there's blue sky. The sky has disappeared, or the clouds have disappeared altogether. And then we can start looking a little bit deeper and we can see the sky through there. And we can see that the sky remains the sky. Vast, clear, empty space. And if we go beyond clouds and we think of something like a rainbow, where does it come from? It appears in the sky and it changes and then it dissolves. And where do clouds come from? Same thing. They arise, they change, and they dissolve. Sunrise, sunset, storms, all of these things. So we're going to use this to actually explain how anxiety, thoughts, and feelings are transient and impermanent things. They come, they change, and they go. And so in the same way, any disturbing thoughts or feelings, panic, anxiety, stress, anger, all of those, they arise like a storm or a rainbow or a cloud, and they dissolve again. So let me talk you through this exercise so you get a bit of a taste. Find a position where your back is straight but not tense. And then you can gently close your eyes, either halfway or fully. Just relax. Take a moment to ground yourself. Become aware of the sensation of your body on the seat. The feeling of the clothes on the body. And then the feeling of the breath coming in off the nose and going out again. So for this, we breathe through the nostrils. And if your mind is quite busy, just take a few moments to keep bringing it back to the breath. Always coming back to the breath. And now imagine you're looking up at a big blue sky. It's a vast, clear, empty space. Always the same. And if you had to watch the sky for a number of days, or take a recording and then speed it up like on the Weather Channel, you would see many different things arising and dissolving within the space of the sky. You might see clouds going bigger, smaller. They might become storms, and there might be rainbows. And all of these things would arise, change, and dissolve back into the space of the sky, moment by moment by moment. So we can think the true nature of my mind is a lot like the sky. My mind is a vast, clear, empty space. Not nothing, just a clear space. And within my mind, the inner weather is my mental activity, my thoughts and feelings. And this is going in a constant stream. So the object is not to have a blank mind, stopping all mental activity. It's very difficult to do and it's completely unnecessary. What we are going to do is to simply remember I am the sky, and I'm going to now observe my inner weather. And I'm not going to be looking at the content of what is arising, that doesn't matter. What I will be doing is observing the process of things arising, dissolving, moment by moment. So turn your attention inward and simply observe this process of things arising, dissolving. Doesn't matter if they're thoughts or feelings, pleasant, unpleasant, random, past, present, future. It's always a mixed bag of all of that. And we're simply watching, so don't follow, just watch. Just see how everything that arises, dissolves, arises, dissolves, back into the clear space of the mind, moment by moment. And if you notice you become distracted, either following something in your mind, remember, don't follow, just watch. Just watch this process of arising, dissolving, moment by moment, within the space of your mind. And eventually the mind becomes very relaxed and peaceful. There's nothing to do, nothing to stop, nothing to push out, and nothing to engage. You're simply watching. Very relaxing just to watch, not have to do or stop or modify. And now you can relax your concentration. And when you're ready, gently open your eyes. And finally, I'd like to leave you with something which always motivates me and which I often quote. And this is by Alvin Toffler, futurist, who said that the real illiterate of the 21st century will not be those who can't read or write, but those who can't learn, unlearn, and relearn. So the good news is that yes, there is a biological base for anxiety, but there's a huge learning component. We can learn how to work with our genetics. And we can definitely learn how to observe the anxiety or use all of the other techniques I've mentioned today. So that's the key thing. And especially with panic, you learned it, you can unlearn it. And with generalized anxiety disorder, you learned language, you learned this narrative, so you can unlearn and you can relearn.